Hi, and welcome to Health Happens video series. I'm Dr. Bob Braile. Today we're going to be asking the question, what is a subluxation? That's a term you hear a lot in a chiropractor's office, a subluxation. It's the main focus of what chiropractors work on, but in many cases people don't understand exactly what a subluxation is. So we're going to spend a minute or two on that. Before we can, in order to understand what a subluxation is, you need to know what protects your nervous system. And by that I mean your nervous system is extremely important, but it has built-in protections. We'll start off with what it is that protects your brain. It's the skull, a solid sheet of armor. No other part of your body has that kind of protection. And at the bottom of the skull is an opening where the spinal cord, which comes off of the brain, goes down. Now, what protects the spinal cord? Well, the spine itself. Okay? Rings of bone stacked on top of each other, 24 movable vertebrae, and the base bone, the sacrum, and the tailbone, the coccyx. Very good, but flexible protection. Now let's take a little close look at this for a minute, because this is important when understanding what a subluxation is. This is a side view of some of the spinal vertebrae in the lower part of the spine. Couple of features here. First of all, the vertebral body is always the big square, whitish looking part on an x-ray, very easy to see. Between each one of those is the disc. That's the shock absorber. It allows the bending, the motion, the twisting. Now, unfortunately, it's a pretty misunderstood piece of anatomy because, first of all, you can't see it on the x-rays, but most people have heard the term slip disc, like these can slide out of place. Unfortunately, that's physically impossible. Discs cannot slide. There actually is no such thing as a slipped disc. Discs are firmly rooted into place. Now, they can be squeezed, in which case they bulge, and they look like they've slipped. And that's commonly what's known as a slip disc. But discs themselves cannot actually slip out of place. It's physically impossible. And between each one of these vertebrae is the opening where the nerve comes out. And that is vitally important because that's where the nerve comes out that goes to the various parts of the body. It has to stay nice and wide. It has to stay open so that the nerve going there can transmit the important messages from the brain to the body part. So what happens here? What takes place is that a vertebrae can move out of position and start to narrow that opening. When it does so, it puts pressure or irritation on the nerve root. So wherever that nerve goes, something is not getting full nerve supply and it can malfunction. As little as 45 millimeters of mercury pressure for as little as 3 minutes on that nerve root will change the impulse by up to 60%. That's more than half. That's a lot of change, so that's going to have a large effect on where the nerve goes. When this happens, when the bone moves out of place, puts pressure on the nerve, and changes the way that nerve functions, we call that in chiropractic a subluxation. This is what we work on in chiropractic. Vertebral subluxations, misaligned vertebrae, putting pressure on or irritating nerve, changing the way that nerve functions. Wherever that nerve goes, something is not going to be working properly. However, very importantly, 80% of subluxations cause no pain whatsoever. You can't feel it. You don't even know that it's there in 80% of the cases. It always causes malfunction, but in most of the cases, nothing you can notice. See, in chiropractic, this is what we do. Chiropractors work to correct subluxation, to get the nerve to function better, and allow the body to heal itself. The major focus of chiropractic is the correction of subluxation. Thank you for watching this episode of Health Happens video series. To see more episodes and get more information, go to our website at georgiachiropractic.com. Thank you.